big changes ahead and a lot of things that happened this year that made the headlines. So I'm really excited to kick this part off with one of the most exciting acquisitions I personally thought. I've known GreatCall for years and they've been doing amazing things, and to see that Best Buy looked at them the same way was very exciting. So I want to welcome all of them to the stage, and I'm just going to introduce the moderator. You guys can come on up. I want to introduce Jane Sarasone Khan, who titles herself a health economist, advisor, and trend weaver. She has a brilliant blog, Health Populi, sorry. And why don't you guys all come up on stage, and let's give them a round of applause. I think this is going to be really special. Thanks. Thank you.
Thank you. Hi, everybody. So this is David, and this is Ashish, and I'm Jane. And I am so delighted. I needed Randy Kellogg's Omron blood pressure watch because I wanted to see what would happen to me in the next hour. I'm with you for a whole hour, which is a real, I'm really grateful for, to talk about and brainstorm with smart people my favorite sort of ecosystem story in healthcare happening now, which is retail health. If you read my blog at Health Populi or follow me at Healthy Thinker, you know my mantra is the patient is the consumer, is the payer, particularly in the US, but all over the world in many cases. And so we're going to start with this amazing story of two bedfellows who walk into a bar and, you know, Best Buy, a retailer who came through the recession, another story, and a very mature senior targeted phone company, GreatCall, and how they came together. So first, David and Ashish, I was going to ask you to just introduce yourselves to the audience because you both have great stories. So who first?
Sure. I'm Ashish Saxena. I'm president of Best Buy Health, which is a team that is looking at bringing technology-based solutions to address everyday health needs of our consumers.
Great. David?
And I'm David Inns, the CEO of GreatCall, and we provide solutions to help seniors stay independent and healthy at home longer.
And if it's not ringing a bell, if I watched MSNBC late last night and there was an ad for GreatCall, the Jitterbug senior phone, this is where it came out of.
That's where it started.
Where it started,
yes.
But we've evolved since then.
Yes.
So you know the brand, you just don't know you know the brand. So guys, how did this marriage, merger, alliance happen?
Sure, I can start and then
yes,
please. On that. Actually, I was reading your blog after the GreatCall acquisition was announced, and you said something really very funny in that, and actually very wonderful summary. You also said there are only two things that will go on: aging and Best Buy. So thank you for saying that.
Aging and Best Buy, it's true.
But I think the question of what got us together requires me to pan back a little bit and just tell you, because I think in some ways that's a thesis of what we're trying to do. So I apologize for a slightly longer answer than necessary, but I think it's important for me to build it up. So if I step all the way back, Best Buy is fundamentally a purpose-led company. And last year when we had our Investor Day presentation, we talked about that there are everyday needs of our consumers that can now be addressed with technology, and that's what we are after. And one of those needs is health. The amount of technology that is coming into the world of health is tremendous, and we thought we need to play our part in making sure that the everyday health needs of our consumers are satisfied. What was interesting was that led us to try and understand this extraordinarily complex sector. And a few things came out of that. One was a very simple idea, which was that today if I'm sick, I have to go to a doctor or a hospital or an ER, and that's the last time I want to go because I'm sick. I want to be in the bed at home, but healthcare does not transact in the home. And I think that became the first thought that we started to play with, which is that how can we bring healthcare transactions into the home, powered by technology, powered by Geek Squad, powered by other assets that we have. And the second was that, again, this is still a very large space, and we knew that we will drown if we don't focus. So when we looked at this whole space and looking at all the macroeconomic trends and talking to some of the most amazing companies that we work with, it became clear that focusing on seniors was a good starting point. So seniors in the home powered by technology-based products and services became something that we thought was not just an opportunity, it was truly a mission, it was truly a purpose, and we were excited about that, and we wanted to do our part in that equation. And the last thing I would say is that when we came up with that and started looking at what Best Buy brings, we have tremendous assets. Geek Squad, or our multi-channel retail network, we do 2 billion interactions every year with customers. So there were many pieces of the story that needed, but still the capability stack was not complete. And we then started looking for a company that could be a great complement to us, that could bring leaders like David, who understands seniors, who have deeply understood that whole context, who have infrastructure, like the caring centers that we have, which is how people can be served, who have remote monitoring platform, because it is an intrinsic technology to serve that. So when we looked at all of that, and I personally went around with lots of companies, there was just nobody anywhere close to what GreatCall was. So long answer is that's what led us to coming together.
And David, from your point of view then, what's the yang to that yin?
Yeah, so for me, the AARP study that was done a couple of years ago talking about the family caregivers who are basically people taking care of their elderly parents or involved in their care in some way, that it was about 70% of them wanted to use technology to help become better caregivers, to help provide them with peace of mind and help them in their caregiving journey. And, but very few of them were actually taking advantage of it. It was actually 7% were actually using technology to help them in this role. And I think the big picture there is that there's almost 40 million family caregivers in the United States today involved in this role. And they all want to use technology to help improve them, but they haven't been adopting it. It's a huge market, and it's obviously underpenetrated. And one of the reasons is because no big consumer brands have really taken that step forward into the space to help raise awareness, to provide a proper distribution channel for it, and so Best Buy taking that step forward really just provides the distribution. It's going to help increase the awareness and really puts us in a position to help the caregiver and really expand that market beyond its current penetration.
And if you haven't read that AARP study, you should, because caregivers are a huge part of the whole longevity economy, and they need to be served too. But back to the household of the senior, because that senior has been so underserved by digital health. We've been wearing wearables for over 10 years now, and seniors really haven't been addressed by the fitness, wellness market, and yet need to more than anyone. So what are some of the needs that in your research, and David, you come out of this naturally and are informing Best Buy in this, what are some of the unmet needs that this alliance, this new thing, is going to address to meet?
So I would say, seniors don't need technology. Mm-hmm. What they need are solutions to help with things like loneliness and transportation and meal delivery and emergency services and fall prevention. And so those can be enabled by technology. Yes. But what happens most of the time when we get too focused on the technology is you end up delivering technology, and that will end up failing. Mm-hmm. But just as importantly, what the senior needs is what the caregiver and the healthcare system needs, which is that visibility into what is going on with the senior in between visits, in between family visits, in between doctor visits, but when they're in their home, what is going on with them? If we can get some visibility into sleep and movement and communication and eating habits and how much they're getting out of the house and taking that data back, we can predict and understand if something is going wrong with that senior before it becomes an expensive healthcare problem in which the senior loses their independence. If we can catch it beforehand, that's going to help reduce healthcare costs, it's going to help the seniors stay in their homes, and it also helps the caregivers provide them with peace of mind.
Mm-hmm. Yeah. Just to add to what David was saying, I think also as we look at the senior, and one of the studies that we all talk about is the work that AARP was doing in this space, was a great partner of ours, trying to understand everything it takes to actually live independently in the home for a senior. It's a complex mix of things. Some of them are technology-based, some of them are not. Coming into the home and inspecting whether there is a fall likelihood or slip-proof, all the way to are there safety protocols in the home and so on and so forth. So I do think that one of the unique things that we are trying to do is to step back and think comprehensively. on what does it actually take to age in the home for a senior, and then working with our partners in trying to be the place that can do that. I think that's one. And the second is very quickly, all the work that we did with seniors kept pointing to the fact that if we can bring technology and human dimension together, magic happens. Actually, our whole pursuit started because we were getting this feedback from our in-home advisors and Geek Squad agents of what needs seniors seem to have that technology can do. And I think what we are trying to do is trying to bring those two things together. Can we bring great technology-based solutions? Can we bring a lot of human dimension in the home, remotely? And together, if we can help a senior live.
If I could just add one other thing is, you asked about some of the things that have failed, and one of the obvious things is you have to approach the space with a wide array or a portfolio of solutions because everyone's so different. And people forget sometimes that the 75 plus population, the penetration of smartphones is only still 30%. So, and it's changing, but it's not changing that fast. So it's, that statistic just shows we can't solve this with just apps. And expecting too much behavior change from the population we're trying to address is a very dangerous slope because you can't expect massive behavior change from the population that we're trying to serve. So that's why we like things like activities of daily living monitoring versus vitals monitoring, where in vitals monitoring, maybe you have to get a new blood pressure cuff, you have to get a new device, you have to now be prompted to change your patterns, whereas ADL, activities of daily living monitoring, we just put in the sensors, you live your life the way you normally live it, we collect the data and can determine if something's going wrong so that there is zero behavior change expectation of the senior.
So for those of you who don't know what activities of daily living are, ADL, they're things like, can you cook a meal? Can you dress yourself? Can you go to the toilet? Can you bathe? The everyday flows that younger people take for granted, but they're huge limitations for some older people, and quality of life, and then loneliness, of course, can kill. We have new data about that. So when we think about, as you were talking, Ashish, about tech and touch, Lisa from Cigna earlier talked about Omada Healthcare, and that's one of the secrets in their sauce, which is a big technology platform, but human care, community health workers. So is the Geek Squad the community health worker, and I put that in quotes, is that the human touch you're gonna bring to this?
I think the way we look at it is it's all based on the need that we are trying to address. So it is true that Geek Squad has a very integral part to play in bringing the technology in the home, making sure it's working, making sure it's configured individually to the unique needs, making sure that they can check in and so on. But there are other touch streams that are also particularly important. Our in-home advisors, they go into the home and just provide advice, drop in, check in. We have a very interesting set of trials going on with some pairs where some of their trained resources are coupling with ours to do that. So I think what is important for us is to bring technology and touch, as you very rightly said. And it's going to be done in partnership with many different companies that believe in the same mission.
What kind of partners do you imagine? And you don't have to name names unless you want to, but categories of partnerships to complement what you're doing, because you can't do it alone. We know that. Nobody can do anything alone in healthcare anymore. So partnership is the new black, collaborating. What are the sort of verticals or horizontals that you both see in an ecosystem in your future?
I can start. If you look at the central thesis that I was starting with, which is let's bring healthcare transaction into the home. That is, let's make home a node in the healthcare delivery architecture. What's fascinating about that, based on all our work we've done, is that it is surprisingly good for all key stakeholders. So seniors want to live longer and happier in their own homes rather than in other outlets. The payers and providers prefer seniors to be in their home and only access when it's actually needed and prevent readmission and reduce cost to serve. And for Best Buy, again, because we can provide technology. So what was interesting about this idea was that it seemed to be of interest to everybody. And that led to all the fundamental belief that we have that this is something that we're going to do together with some of the best payers, some of the best providers, some of the best technology companies who have products and services, because it seems to be that all of them seem to be wanting to do that, and we're all completely in the same mission to do that. So I think partnerships are a very integral part of that, and I think that's one of the thoughts that we definitely wanted to leave behind today too.
And you've worked with partners for
well,
years.
And I would just add to that, I think we're also really looking to partner with other technology companies. So, because the same thing goes there, the piecing together the best solutions to bring into the home is going to be what this is about, not just trying to keep proprietary components. So making sure our solutions can be offered into other platforms and other capabilities is an important part of this going forward.
Amen to those who believe in open source healthcare.
Yeah.
I'm one of them. So we talk about the home, the home, the home. And as we all walk around CES 2019, there's a lot of smart home activity now. When I started coming here 9 years ago, digital health was like 24 companies. It was Fitbit and Under Armour and a few more. But now I have to go everywhere. I have to go to Las Vegas Convention Center because there's smart connected car, the third space for health. And of course, smart homes here and down to the Cosmopolitan to talk about media and content. So home, Best Buy now channels smart home stuff. Do you imagine smartifying homes for older people in that way where we look at wellness in the home?
Well, firstly, Best Buy has traditionally always been the platform for innovators. That is, bring technologies. That's a role we have been playing for a long time, and we continue to do that. You're also right that when you look at health, specifically for seniors in the home, it has the lines between security and communication and other needs start to blur. So, I mean, for example, Lively Home, which is the remote monitoring platform that GreatCall had, that is now being used extensively, is pretty fascinating. It puts all these sensors and other attributes inside the home, tracks data, and look for errand patterns, that mom was tossing and turning a bit more than usual in the bed, has gone to the bathroom often, has not come, she typically comes between 8 and 9 a.m. into the kitchen, but hasn't come today. So, and just being able to do pattern recognition to do that. Now, is that safety? It is, because it is providing safe access to the caregiver. Is it health? Yes, it is, because it has clear markings to doing that. So what I find fascinating in this whole smart home, smart health world is the blur into this one continuum of what does it take to actually live independently in the home.
That's great. What do you think?
Well, I was just going to add that, yes, I think that there's a lot of work that can be done to customize the smart home solution for the senior caregiver world. It's not just a standard, smart home installation if you're really trying to get a different benefit out of it. It's not just about being able to, turn the lights on and off and listen to music when you want and know when somebody's left. So there is a lot of opportunity to take what is existing as a category and help make it more valuable for the senior and the caregiver that are in that caregiving relationship.
I'm sure voice-activated assistants are a product, a technology that you channel to lots of people. And I have a health IT, FDA-regulated side of my life too, so I go to HIMSS in a few weeks. Maybe some of you are going to HIMSS for more of the clinical side of healthcare. But we're seeing Alexa tools and Google Assistants proliferating in healthcare very quickly. So the trajectory, the adoption curve is quite steep. Do you imagine voice will be a friend to aging safely and well at home?
Yeah, absolutely. I think we've seen the penetration of Amazon voice-based products into senior homes is obviously significant. I don't know the statistics. I haven't seen them broken out. But I did see an article the other day. It's now 100 million installs of Alexa devices. So, I mean, it is huge. It's very helpful. It's a friendly way to interact with the technology, and I think it's going to be a big part of it going forward.
Do you think that's adult-child driven, gifting it to a parent, or are seniors themselves saying, I want that companion? Or is it a mix?
It's probably a mix. I think it started off with caregivers, but our experience has always been that we have a lot of seniors buying our technology directly from us for themselves, by themselves, wanting the safety and security that the products bring. And then about half the time it's the caregiver involved in trying to drive the adoption, making that purchase for them or with them.
Do you see that?
Absolutely. I remember when we started working in this whole space, we launched a service, Assured Living, which was basically an IoT AI service to remotely monitor. And what was fascinating was working with the seniors and the caregivers was that each home needed a slightly different on-ramp strategy. Some was that all I need right now is Alexa, just tune it for me and just make it work, because for now that's all we need. Others, I need that, but I also need a jitterbug so that I can have it. So I think the point is that we are friends of simplification of UI. Voice is a great interface. Human is a great interface. Coming into a store so that you can actually see it and play with it is a great interface. And we support all of that movement. Simplification of UI is something that we constantly keep seeking. And there is going to be more new UIs that will start to show up.
I think a lot of people don't know about Assured Living. Can you give a little blast on that since you mentioned it?
Sure. I mean, Assured Living was our initial start at monitoring activities of daily living, as you very rightly said, which is because actually GreatCall has published some peer-reviewed journal on the value of ADL monitoring and how it does that. So that was our first step. Assured Living was that, and we looked at Assured Living first as a consumer-oriented offering. Because that's what for us, our start was that we were not looking at patient, we were looking at the person. And this difference of thinking in terms of it's not the patient, it's the person first, led us to start with a consumer-oriented proposition, a B2C type proposition, which is what Assured Living was. That helped us understand what does it actually take for seniors to live in a world where data is around them, and what value can be delivered. That led us to also saying, let's go talk to payers and providers and start the other end of this puzzle, which is a commercial end of that. And I think today we are doing both of that.
And that's a super important part of the way to approach this market intelligently. Is I think a lot of the failures have been because sometimes it comes only from the commercial side. So you're developing solutions that are being demanded by the caregiver or by the healthcare system, and not taking the end customer into account, who's going to say, I don't want that. What is that? Right. And no, I'm not going to adopt this technology, or I'm not going to change my behaviors, and so forget about it. And then none of the solutions work. So always going to market thinking about what is the benefit to the senior, what are they going to actually be able to adopt, and what kind of behavior change am I expecting, and thinking about what does the healthcare system want, and keeping those two things together, not separate, because you have to basically address all of their needs.
So it's interesting at CES we see a lot of B to B to C, but this is B to C to B. Interestingly enough, if you were here earlier to hear Sean Carney from Philips, the guru of design there, who gave an amazing presentation. They do this because they work on both sides of the house with clinical devices and personal health. So he thinks, and they think a lot about what's the workflow of the clinician and payer, because they work with systems too, and of course the personal care side, moms caring for kids, caregivers caring for older people. But this is an underutilized approach, as you're pointing out. So if you can bring that together, that's innovation. It doesn't sound like innovation because it's not about the technology. It's about user-centered design and who are the users. And that's a major lesson to remember walking around the floor here, that it's not about the technology, as David said and Ashish said. It's about what's the utility and what are we trying to do.
And the point you also touch upon briefly, which I think is also very interesting, is the minute you look at both sides of the puzzle together, yes, the business model innovation opportunities become quite powerful.
Very creative. New business models, right? So I'm looking at the time, as we look to the future, which we always want to do, the tea leaves, looking at new partners, new business rules, new technology, the power of 5G coming in, and AI, real AI, to the consumer's phone or voice assistant. What do you see that you can share with us in your vision, looking out to the future for this new world of yours?
Don't talk about 5G, because I just finished trying to get people moved to 4G. So.
Well, there's a lot of hype around it here, and I'll say that. So
yeah.
Anyway,
no, I'm kidding.
But that will make things faster.
Yeah, for sure.
Eventually.
I think our almost like a concluding thought in this, to some extent, is we are maniacally focused on making seniors live independently, healthier, happier in their own homes. We think that'll actually help the payers, the providers, because they have the same shared mission, and it'll help the seniors and the caregivers to doing that. In that pursuit, it is extremely clear that it can't be done alone. And I think there are the few specific things that I see happening out. One is interesting companies are going to come together to do this, because this is a pursuit that requires one. Second, I think home is going to become an increasingly important space in the healthcare delivery architecture. And the third is that at some levels, the kind of work that, for example, GreatCall team is trying to do is looking at can you predict rather than can you always remain reactive. So for example, one of the work that they're doing in this is fall prediction, which is tracking gait and so on and so forth. So can you bring in an element of predictability so that you can get ahead of these problems and try and do that? I think those things are likely to play out and have consequential impact. What do you feel there?
Yeah, I think that is exactly it. The predictive capabilities of getting data from all sorts of sources is going to be the key to the future here as well. So, having access to data from privately, securely, but from devices. We were just talking this morning, being able to predict depression by sampling a voice stream coming from a senior's phone, without listening to the words that are being said and not disrupting privacy, but being able to actually just listen in and from the tonality to be able to predict the onset of depression, which super, super powerful. Because as you said, I mean, that's a key leading indicator of if it doesn't get addressed, that's going to become probably an expensive problem very soon after. So being able to do those kinds of predictive capabilities on just random data pieces that we can piece together is going to be a huge part of keeping the senior happy and independent in the home and not in long-term care, keeping the caregiver, giving them the peace of mind, and keeping the healthcare costs, in line for the senior.
Well, I can buy into all that. And that whole scenario is also relevant to some of us younger people who want to stay resilient in wearing many hats. So I don't think you could just sell this to people over 65 or whatever your target is. But we all want to be resilient, and everybody's stressed, and a lot of us have loneliness, and the deaths of despair happen between 45 and 54. So I think you're going to be able to help a lot more people than even your initial target market.
Tell me about it.
Yeah.
Are you feeling lonely?
Yeah.
You should just tell me.
Interestingly, we noticed in the big Easter Island had pictures of us. The two guys grew beards since the acquisition and merger. So we're busy. We don't have time to shave, I guess. There are some nice electric shavers on the show floor.
My wife told me that the more you cover, the better it is.
I got it. Well, I want to thank these two amazing innovators, and we don't use that word lightly, for coming here to share this announcement and brainstorm this really important topic. Thank you so much.
Thank you. Thanks, Jay.
So fun. Thank you.